Good evening, everyone. We are Field Trip Health, and we wanted to say thank you so much for joining today to learn about the healing modality that we facilitate out of our Field Trip Health Atlanta Center. I am joined by some, not all, of the dedicated, hardworking, compassionate care team that you will meet at Field Trip Health Atlanta, and I'm really excited to introduce to you to them. While the COVID-19 pandemic has affected lots of parts of our daily lives, it has not affected our thirst for knowledge. So I'm excited to introduce our members of our Atlanta team, starting with Medical Director Dr. Michael Mensch to deliver this presentation. Thank you and enjoy. Please make sure also that we have a chat function on the side and we have polls that will be populated throughout the presentation for us to get to know you, to interact with everyone else around you. We'd love to hear from you throughout the session.
Hi there. First, I want to thank everyone for joining us tonight. We really appreciate it. And I think there's probably a real diversity of experience and knowledge on this topic. So I just want to acknowledge that we're speaking to a broad audience, and bear with us. We're going to try to target it to the full range. I wanted to just introduce myself a little bit. My name is Dr. Michael Mensch. I am a family physician, a general physician. I grew up in Miami, Florida, ended up going to med school and residency there at Jackson Memorial Hospital, University of Miami Hospital, where I was born. And I've had a keen interest in psychedelics and immersion in the psychedelic world for over 25 years. My formal study of psychedelics really began in medical school when I began to see the superficiality of a lot of medical conditions and symptoms are approached. I saw mental health as digging a little bit deeper, and that interest and my interest in psychedelics led me to travel to the Peruvian Upper Amazon during medical school, and I made several trips down there. And that completely changed my perspective on just about everything, and particularly about the nature of health, the nature of the healing process. And that set me on a path. I pursued general medicine going forward with an aim to bridge the gifts of Western medicine with the gifts and possibilities that are catalyzed by non-ordinary states of consciousness that are offered by psychedelics like everything from ayahuasca to ketamine. I eventually found my way to the California Institute of Integral Studies, their program in psychedelic-assisted therapies and research. And that one thing led to another, and I became involved with Field Trip Health. It's a huge honor to be the medical director of the Atlanta clinic of Field Trip Health, and I'm so grateful to be supported in this incredible adventure by some amazing staff, some of which are here on this webinar. So I think we can perhaps go to the next slide, Alec. So what do we mean when we say psychedelic? Psychedelic is means a lot of different things to different people. It's a word that has carried a lot of cultural baggage and kind of made a resurgence. And you break it down, the etymology is from the Greek words psyche and delun, psyche meaning soul, and delun meaning revealing. And just to note, psychiatry really means soul medicine, and to me that's the goal that we should all strive towards, to go deeper. So psychedelic, what we're talking about is a process of opening as opposed to closing or suppressing. It's a fundamentally different approach to mind and health and healing, where you are seeking to reveal and open up and move through rather than to avoid, suppress, and sort of close away. And there's been some other words that are used. Hallucinogen. A lot of us don't like that because it implies seeing things that aren't there, which is not really a typical experience from psychedelics. Technically, hallucinogen is accurate. It means it's from the Latin hallucinare, which means wandering in the mind. So it's not a bad word, but I don't like it too much. Entheogen is another word that's come up. Basically talking about the same substances, the same medicines, but it's more of a cultural, anthropological, religious, spiritual description. So we typically don't see that in a clinical context, like when we're using psychedelic medicines as a form of treatment for medical diagnoses. I think we can go to the next slide. So it's no secret that we are facing an incredible challenge with the problems that we call mental health problems, for lack of a better phrase. The way we have approached these problems conventionally has been basically stagnant and at a standstill for decades. And the problems just seem to get worse and worse. I think we can go to the next slide. We have some graphics. So the last major development in conventional approach to depression, for instance, was in the 1980s with the development of Prozac, and then that was followed by many other variations of serotonin reuptake inhibitors and similar medications, none of which are meaningfully, significantly very different than the original ones. And we've kind of been stuck there for decades. The SSRIs have a lot of problems. There's non-adherence. There's a whole lot of side effects, which feeds into non-adherence. And they don't actually help as many people as we would hope. There was a lot of enthusiasm. I don't know if any of you remember the book Listening to Prozac back in the 80s, early 90s. Those hopes that enthusiasm gradually faded around 2006. There was the STAR-D trial, for instance, that showed that a lot of these medicines weren't a whole lot better than placebo, and that for the ones who benefited, great. For the majority whose depression wasn't resolved by taking an SSRI, the chances that it would improve or resolve or stay resolved for long term became increasingly unlikely. And so that's the issue of treatment resistance. I like to talk about what I call suppressive medicine. The best example of that are things like benzodiazepines, which just are kind of like turning down the volume on the mind. SSRIs aren't quite exactly like that, but they are subtly suppressive in their own ways, in that we don't see a lot of people moving all the way to the finish line, so to say, through these conventional therapies. They can improve functionality, they can improve some symptoms, but as far as going deep into the roots of our symptoms and our experience of suffering, I think they fall short. As our approaches to mental health have not been evolving or progressing, mental health burden has exploded. Just in the past 20 years, since 1999, the suicide rate in the United States has increased by 35%. And that rate also is even higher for LGBTQ people, 4 times as high. Suicide attempts, 12 times as high for transgender people. And also, I would be remiss if I did not mention the epidemic of suicide, depression, burnout, and suicide among physicians and healthcare professionals. Every year in the United States, about 300 to 400 physicians commit suicide. And I think that, it really highlights that it's like a restaurant where even the cooks are starving. We're in crisis, and we need help. And I think Tabitha is going to talk a little bit about what that help looks like. We can skip that slide.
Hi, thank you, Alec, and thank you, Michael, for that fascinating background in psychedelics. I am so happy to be here today talking to you about what I consider to be one of the most promising uses of a medication in a very long time. I started my career in healthcare as a registered nurse in 2003 and continued on to become a nurse practitioner specializing in emergency and trauma surgery. In our city's busiest emergency departments, I witnessed the heartbreaking reality of a failed mental health system. Lacerations and broken bones are easy to fix compared with trying to find solutions for those experiencing an acute mental health crisis. During my own wellness journey, I began to look for opportunities to blend my career as a nurse practitioner with my personal passion for wellness, mindfulness, yoga, and lifestyle medicine. For me, Field Trip was that perfect opportunity, and what an exciting time to be working in psychedelics. So some of you may be out there shaking your head thinking, Tabitha, you're talking about drugs here, right? But I think it's helpful to establish a bit of history and context. Sometimes it's good to remember where we've come from and hopefully to prevent making the same mistakes again. So if any of you were alive in the 80s, you probably remember this commercial. The sizzling egg was meant to represent the effects of drugs on your brain. And did you know that the Entertainment Weekly named this commercial the 8th best of all time in 1997? There's no doubt that this commercial and ones like it had an impact on society. And the reality is that the Partnership for a Drug-Free America and other tools used for the war on drugs had a devastating effect on all of us, and we still feel it today. It contributed to mass incarceration, systemic racism, and needless poverty. Not to mention the social stigma that has been attached to all drugs that the medical community today recognize and acknowledge the benefit of. Cannabis and psychedelics are examples of that. So it would actually be more accurate to say this. This is your brain on drugs. These images were actually captured on a special type of MRI called a functional MRI. You and I are probably more accustomed to looking at structural MRIs. But this is really exciting because it has given us a lot of insight into how a healthy brain works and also what a disruption in normal function looks like. So depicted here is increased functional connectivity of the brain under a high dose of psilocybin compared with a placebo. So psilocybin is the psychedelic molecule that we find in magic mushrooms. A simple interpretation of this may be that psilocybin relaxes the usual constraints on our brain and temporarily creates a more unified and interconnected brain. Some think that these constraints, or think of these constraints as stuckness or rigidity, and psychedelics seem to allow us to bypass or loosen that stuckness. Another prevailing thought is that with the influence of psilocybin, a brain network called the default mode is relaxed and actually down-regulated. This is the self-referential part of your brain. And some say that if the ego had a home, this is where it would live. However, there's a lot of research still left to be done in this area. But how exciting is all of this, that there is an opportunity to explore parts of your consciousness that may have previously been difficult to access, even with like extensive psychotherapy and meditation type practices. So that is why we have developed our program to help our clients access their own inner healing intelligence. Because in our experience, there is a rich amount of creativity, insight, and healing available within. This is an actual picture of a functional MRI of that region of the brain that I talked about called the default mode. So I don't know if any of you recognize this or have seen something like this before, but this is probably something that you've seen at some point in your lifetime. But consider this. Psychedelics like ketamine, MDMA, and psilocybin gained a lot of notoriety in the rave and party scene. And there are certainly concerns when used in this context. However, we believe that using them for going out may not actually be their most profound application. I would argue that psychedelics are much more useful for going within. And I'm not actually the only one making that argument. There is hopeful research on psychedelic applications for addiction, end-of-life care for the terminally ill, acute suicidal thoughts, chronic pain, and of course, treatment-resistant depression, PTSD, and anxiety. This is an actual picture of a typical journey here at Field Trip. And we'll share more about this later when we discuss our set and setting. Any questions so far? Great, so let's move on then. So thinking about,
yeah.
Oh, I'm sorry, what about?
Let's just keep on moving. It is all good.
Okay, all right, let's keep on moving then, perfect. So thinking about our current approach, if you work in healthcare in any capacity, you will probably agree that SSRIs seem about as common as aspirin. And I'm talking about, again, the class of antidepressants known as the selective serotonin reuptake inhibitors. And of course, we're all familiar with SSRIs, and we should be, because that has been the standard approach to depression treatment for as long as I can remember. And there really hasn't been a whole lot more that's helpful since, honestly. I have worked in healthcare for a long time, and I know that it's critical to always send patients home with a couple of pieces of information when you prescribe an antidepressant. The most important things are, this depression medicine may actually cause or worsen suicidal thoughts. And if it's effective, it may take 4 to 6 weeks before you have a significant benefit. This is what we call the wait and see approach. Then, if there's only mild benefit, we may have to increase your dose or add another medication altogether. So certainly these medications have their place, but let's face it, in the United States, major depressive disorder carries an estimated economic burden of about $210 billion annually. And having an understanding that suicide is the 10th leading cause of death, we believe that there isn't time for a wait and see approach, and you deserve better. That is why we take an active approach at Field Trip, and I'm really proud of that. We provide a tremendous amount of support and guidance to our patients as they navigate their own personal journey. Patients report rapid improvement in their symptoms, often within hours, and we use protocols that are supported in the literature. We truly, truly have an unwavering belief in our patients' ability to heal. And, so for some patients who have tried conventional approaches without success, psychedelics offer hope. We just opened our doors here in Atlanta, and we've already seen emotional breakthroughs. And our overall evidence at Field Trip points to sustained transformational experiences. So thank you guys for listening to that. And I'd like to shift this presentation back to Dr. Mensch, who's going to discuss ketamine with us, the psychedelic molecule that we use.
Alec, I think we can advance to the next slide. Sorry, I was muted there. All right. So ketamine is a very interesting molecule, and when we're talking about psychedelic medicine, the broader landscape, ketamine stands alone. It's different than the classical psychedelics. Classical psychedelics would be things like LSD, mescaline, DMT, psilocybin. All of those classical psychedelics are agonists at the 5-HT2A receptor, the serotonin 2A receptor, and other receptors, but they're primarily acting on the serotonin system. Ketamine is classified as an NMDA receptor antagonist. The NMDA receptor is the receptor that has the greatest binding affinity for. It also has weaker action at opioid receptors, acetylcholine, and multiple other receptors. It also even acts as a monoamine uptake inhibitor for norepinephrine, dopamine, and serotonin. And none of these things alone actually explain what it does exactly or why it helps so much with depression and anxiety and PTSD. And that's mainly because you could start by tracking which receptors it binds to, but the downstream effects are so amplified and get so complex that it's difficult to track. You could think of it as the ecology in a forest, that if you take out one plant or animal or just affect one element in that system, the whole system is going to shift. Ketamine is also has some special advantages. Unlike the classical psychedelics, or like MDMA, which is another powerful medicine that's coming down to greater availability, which they require benefit from getting off of most typical psychiatric medications. Ketamine is very pharmacologically friendly, very safe to be used in combination with other medications, so that usually you do not have to discontinue or even alter most psychiatric drug regimens in order to engage with this medicine. It's also, I like to think of the effects as being kind of in two categories. There's the pharmacologic effects and what I would call the psychedelic or psychotherapeutic effects. And the pharmacologic effects would be, that's what we're trying to do with most conventional pharmaceutical medications, like an SSRI. We're not trying to catalyze a vision. We're trying to benefit from daily dosing and from the pharmacologic effects. And then by contrast, a psychedelic effect would be catalyzing a visionary experience, a psychotherapeutic breakthrough, which is fundamentally different because there's that element of having seen something, having realized something, you can't unsee it. And so there's this durable effect. Michael Pollan talks about the psychedelic experience being like an anti-trauma, in that like a trauma that leads to PTSD, an anti-trauma, as psychedelic anti-trauma can have very long-lasting positive effects. And ketamine bridges those two modes of healing and therapeutic effects. It has these purely pharmacologic effects, which happen historically as a side effect. People getting ketamine for other purposes in the hospital or the emergency room, and then feeling less depressed, feeling less pain in the weeks that follow. And those are like any pharmacologic effect, those are short term. But with lower doses of ketamine, you can achieve some of the same open state that you can achieve with classical psychedelics, and thereby that can allow for those psychedelic effects where you can actually achieve therapeutic breakthrough when you're working with it in a therapeutic context. And those effects, the idea is that those effects are much more durable. There's a deeper healing that happens there that's not dependent on the immediate or subacute pharmacologic effects of the ketamine. I think.
Yeah, this is where I take over. Thank you. Thank you, Michael. Hey, everybody. My name is Ebony Lawson. I am one of the psychotherapists here that works at Field Trip Health. I have been doing this work for about 9 years, and it's always been my passion to help clients always go deeper to access what is inside of them for their healing. And so all of the beautiful things that we've already talked about when it comes to psychedelics and ketamine really leads us to, well, how does this work? Like, how do we blend this molecule into a psychotherapeutic space? And that is what ketamine-assisted psychotherapy approach is, and we call that CAP. Okay, so one of the places to start is to really just understand, what is the benefit? Like, what is the purpose of using ketamine? Like, what is it in the psychotherapeutic space? And essentially, it's a molecule, right? Just like Dr. Muench just explained to us, and it's a molecule that can be used as a facilitation to help clients go deeper, to help clients go within, to really help them access a different part of their consciousness that they might not have access to otherwise in a traditional therapeutic setting. And so that leads me to the set and the setting, which is really, really important when we're talking about psychedelic, because, like there was that slide earlier where they're at the rave and their hands are up and they're partying, right? We've seen psychedelic used in rave settings and party settings, and just being used in places that are non-therapeutic. And when we bring that into the therapeutic space, it gives access to a different way of feeling and a different way of synthesizing this molecule inside of the body. So that is why set and setting is really important when it comes to psychedelics. And when we're talking about set, what we're really talking about is the mindset, right? There is a complete and total mindset that goes along with psychedelics. And that mindset is more of the internal environment, and that includes the person's emotional state as well as their psychological state. So their anxiety, their relaxed state, their excited state, all of these things are really important when we are helping someone shift from just coming out of their regular conscious world into the psychedelic consciousness space. And so we want to bring that set and be reminded of that set. It's really important for me as a therapist to have my own mindset in check as I'm working with clients, because we want to bring a sense of safety and trust, and be able to acknowledge that when the client is under ketamine. And so that is really, really important. So that's the first thing. The setting is the external environment. We have an amazing space here at Field Trip here in Atlanta, and Colin will talk about that just a little bit later, but we have a beautiful space and treatment rooms where clients are not just going into some clinic where they can get hooked up to an IV. They're coming into a very relaxed, ambianced space, and it is decked out here. And if you haven't come to Atlanta, you need to come to Atlanta and visit our space, okay? Because the setting is beautiful, and we take pride in that. And the reason why the setting matters in psychedelics is because, number one, when we're having clients go through psychotherapy and they're ushering in something new, they're recreating a world where they can actually move forward and have hope to release things like depression and anxiety and traumas and things of that nature. We want to model what that could even feel like just from the external space. And so setting includes things like lighting and colors and pictures and paintings and all of these things, because when a client is walking in, our senses is what speaks to our subconscious mind, and they're already going to be going into a subconscious reality when they are in the psychedelic space. So it is really important to capture that with their visual eyes, so that when they do go inward, they're going to be able to take the space and the ambiance with them as they're journeying in their own psychedelic experience. And so that is really, really important. It is in our external environment. Some of the factors that make a difference for set and setting is a client's a client's intention, having a clear intention for what you want to work on and how and the hope and the goal that you're looking to gain and receive from your psychedelic experience can really help increase the space that the client is in, or the healing that they're receiving while they are under their ketamine experience. So having a clear intention is really important. And we really walk clients through that. I'm going to talk about that in just a moment. And then, like I mentioned before, having a very safe, calm, relaxing therapeutic experience, a space where they can come in and everybody feels like home. We've had clients many times say this feels like home when they walk in here and they get a chance to be with us for the time being that they're going to be with us. And that's really important because some people come in here and they've never had that before, or they don't have access to that right now. And so being able to provide that when we are in a space like this really makes a difference to the client's overall well-being. And then another factor that's really, really important is helping the client really understand how to trust, how to let go, how to surrender. Psychedelics is all about surrendering, going in through, let me back up. Like sometimes you hear back in when you're doing psychedelics kind of recreationally, you hear like a bad trip, or you hear people, if they're doing ketamine recreationally, going through K-holes, right? And that's usually because there's a lot of resistance. The setting is not appropriate for the space. It's not therapeutic. They're having a lot of emotions. There's nobody there to help them process that, or to hold their hand, or to help guide them through the journey. And I think that's what really sets Field Trip apart from any other ketamine clinic, is that we really have the ability to walk a client through the experience so that there is safety, so that there is an ability to trust, so that they can take some of those experiences, the scene, and bring that into their waking world and begin to integrate that and process that and see how that really can shift them out of the state that they're in. So that is why the setting is important. That's why the mindset is important. So that is how we get to the whole entire space of using ketamine in psychotherapy. Now, what's really important to know is how at Field Trip do we utilize ketamine? What does that process look like for a client's journey? And yeah, thank you for going to this slide. We actually have clients go through 3 weeks of treatment. And as you can see, this is a slide that indicates from the beginning where a client will start to the end of where a client goes. And that very first module is the very first week that the client is doing the work. And there's a couple of sessions in there. There's 7 sessions, and some of that might be spread out just due to scheduling. But let's talk about what some of those things actually are. Okay, when a client first comes into Field Trip, they will start with a psychiatric consultation, and we have, they'll start with our virtual psychiatrist and get a full psychiatric evaluation to see, number one, are they fit for this compound? Are they fit to take ketamine? Number 2, do they follow the requirements that's needed in order for the work that we're doing here? And then thirdly, does this feel like something they equally want to continue moving forward? Once they get to that psychiatric consult, that doesn't necessarily mean that they want to move forward. It gives a client an opportunity to have some agency and to make decisions about what that looks like. So a psychiatric consult is really, really necessary. And after that psychiatric consult, they go right into a psychological or psychotherapeutic intake. And that's where me and Colin, the other therapists, will do. We will work with the client to get a full background, a history of what it's been like to walk in their shoes up until this point. And what is the goal moving forward? That is what the intake is for. And so after that, this is where the fun stuff really starts to kick in. Okay, and now they get into what's called the preparatory session. And these preparatory sessions are really meant to prepare the client for their journey. So we have a certain set of requirements that is needed so the client can feel safe and comfortable as they prepare. But just like I mentioned before with set and setting, we talk a lot about how to have an appropriate mindset for their psychedelic journey, how to prepare, how to ready themselves to begin the work that they're about to dive into for the next 3 weeks. And it's such profound work. And then after that, we move into our exploratory sessions, and these will happen over a collective period of time. They're twice a week for the next 3 weeks, and a client will come and be in that journey for about 2 hours. In that exploratory session is when they're being offered the ketamine, and a psychotherapist, myself, or one of the other therapists will be sitting with them and offering them whatever it is that they need in the journey. And this is really important because so many things can come up with the client as they're journeying. They might want to talk about their experience. They might have to cry. They might want to hold your hand. Like, there's many things that could come up, and having somebody sitting right there is really profound and beautiful. Those 2 hours do make space for a tiny little integration at the end of it, where the client can just debrief with the therapist about what they just experienced. How does it make sense right now before they move into going back into their regular world? And so that's the exploratory. And then the last piece, which I think is one of the most profound and important pieces, is the integration. And the reason this, I think, is really important is because we can't talk about ketamine-assisted psychotherapy without the psychotherapy, and integration is just that. It is the psychotherapy component. How do you make sense of the things that you just saw? And that is what the integration is for. So a client has 4 of these throughout their entire journey. So there's 6 exploratory ketamine sessions. And then there are 4 integration sessions for the client. So they have enough time to really start digging into some stuff and really try and getting to a space where they can learn some tools, shift some mindsets to get them along their journey. And we've seen such tremendous effects. And if you move on to the next slide, we'll talk about how these journeys actually support the client's experience. Okay. And we're going to go through some slides here that really just capture, I guess, the dosing and the way that the client journeys and has the experience, and what the pronounced effect is for the clients. And this particular chart right here, if you look at it, there's the placebo. And if you remember Tabitha's slide at the beginning, there's the brain on the placebo and the brain in the psilocybin, right? So here's the placebo is in the red, and the ketamine is in the blue. And you can see, based off of day 1, this is over a 15-day period, which is essentially, a 3-week period, what we're doing here, twice a week dosing. At the beginning, people can start pretty high, right? And as you can start to see by that 4th session, by that 4th day, or that 8th day, the 11th day, all the way down to the 15th day, where there's this slight decrease. And it can feel very subtle, just, subjectively, when a client is speaking. They feel it very subtly. They know it's happening, and they can kind of feel it when they're going back and interacting with their world. And this is the beauty of ketamine. Your brain is now officially under ketamine for these 3 weeks, and it is such a profound way to start capturing new ways to live and be and breathe. Okay, if you want to go on to the next slide. All right, and so here is some data around clients that's completed our program. Here's where they were before, and here's where they are after. And there are 3 there are 3 diagnoses that we tend to see a lot. And we tend to see treatment-resistant depression. We see, pretty severe, moderate to severe anxiety. We also see PTSD or pretty severe or complex trauma. And so usually when clients start, one of the things that we do is we offer them a collection of questionnaires. So we offer them the GAD or the PHQ-9 or the PCL-8. Like, these are things that we do to collect data of where are you now? And then we give it to them over a series of the time that they're here, so that we can track their progress over time. And as you can see, there is a decrease from where they begin to where they end up. And they end up in the mild to moderate categories, which is actually really beautiful when you think about it. 3 weeks where some people have been in therapy for 20 plus years and they never get that response. It's pretty significant and really amazing. And having clients go through this is a powerful experience. So clients really can truly see the difference. They can feel the difference, and they can start to see a shift in their lives. All right, you want to go on to the next slide? Okay. And so we've also known that once ketamine has been entered into the system, the physical system, and it starts to alter the brain, once the client comes in for therapy, one of the goals is to learn other tools that can help them, antidepressant tools or anti-anxiety tools that can help support them after their journey is over and after being here under ketamine consistently for those 3 weeks. And with this particular chart, we can see where a client starts at the very beginning of the program to where they are a month later. And those numbers, even though they spike just a tiny bit, they don't spike that much, right? So they still kind of stay even in the mild to moderate category, even 30 days after being introduced to ketamine. And I think that's a pretty beautiful experience when you think about somebody who's been living with a mental illness for a large portion of their lives. And to have this level of hope and this level of relief is pretty powerful when we're looking at their brain on ketamine. And so ketamine has the ability to really take a client from severe to mild and moderate in such a very short period of time. And so, yeah, field trip, I think, is what makes it significant is the therapy component, really helping clients make sense of their journey. So yeah, I'll pass it on back to Tabitha, Michael, Colin.
Good evening, everybody, far and wide. As we get close to the end of our presentation, I really just want to emphasize what Ebony was talking about in terms of set and setting. And so what has Field Trip done here in Atlanta in the Glen Castle location, which is a pretty amazing 130-year-old site. So Field Trip in general, throughout all their clinics, they have a critical focus on setting. And by setting, we mean the physical place where our clients journey. So setting is crucial in contributing to and coloring our clients' journeys. This is where they open to and explore their inner selves, their thoughts, their feelings, memories and fears, and their inner beauty. So in selecting the Atlanta location, Field Trip paid particular attention to soft and welcoming lighting. We have natural candlelight. We have dimmed hallways. Like I said, creative reuse of a 130-year-old stable. It's listed on the National Register of Historic Places. This is no clinic in a strip mall. This is a really beautiful place where people can come and have a sacred experience. We have 14-foot high ceilings, stone exterior walls, and we have not one but two recovery and integration rooms that have soft seating areas, music. We have all kinds of integrative activities, artwork, origami, journaling, stretching, and yoga. And we also provide hydration and light snacks to folks after they complete their journeys. The treatment rooms themselves, we have zero gravity chairs that recline, that massage and heat. We have weighted blankets if clients prefer that. And the therapists themselves are part of the setting and part of the clinic room. Ketamine-assisted psychotherapy, or I should say in a larger sense, psychedelic-assisted psychotherapy is one of the few modalities in which therapists can use touch. Say, in the setting, maybe someone becomes disoriented or fearful. The therapist and the client beforehand could talk about agreeing on the use of such maybe a handhold or a shoulder touch. And so that's something else in the setting that the therapist can be used in that way to make sure that a person feels comfortable in the setting as they embark on a new experience. The use of sound, we have noise canceling headphones. We provide eye shades. We use, as Ebony was saying, playlists. They can be curated by the therapist in collaboration with the client or pre-selected. And we use a microphone to communicate through the noise canceling headphones so we don't have to interrupt the person's experience. And then lighting in the rooms themselves. So we've begun in Atlanta implementing colored LED bulbs, and we can tailor the light to the client's preference. So when they're coming out of their journey, they might be a little bit dissociated or confused. At least they're coming out into a room that might be a color that's comforting or familiar to them. And I guess to back up what Ebony was mentioning in terms of set or mindset, really the other crucial factor to ensure a safe therapeutic experience during a non-ordinary state of consciousness, of course, is mindset. You might also think of mindset as a significant differentiator between recreational use of psychedelics and the type of intentional psychotherapeutic use of psychedelics and NOSCs that we focus on here, or non-ordinary states of consciousness. So again, a focus on a peaceful, safe, and tranquil mindset is crucial to the content of the journey and to maximizing the safety and efficacy of this window, this therapeutic window, or they call it a window of neuroplasticity, in the days after the ketamine administration, when the mind is most susceptible to therapeutic growth and progress. Also, to again emphasize what Ebony was talking about in the preparatory session, that's really key to educating clients about the importance of mindset, such as their sleep, any substance use, especially avoiding alcohol and stimulants, monitoring life and relationship stressors both before and after their journeys is important. When I think of set and setting, I think a lot about the fact that the ketamine that we use to induce non-ordinary states of consciousness is just the catalyst. It's the client's own mind and their experiences that generate their journey. So we have a huge responsibility, if we're going to do this right, to create a setting that's safe and peaceful and comfortable, and to help clients learn, to teach them how to create a mindset where they'll benefit and be susceptible to the therapy that we're doing here. And just really during their journey time, during their treatment here, trying to monitor the chaos and confusion of their daily lives. So bottom line, the mind is wide open after the administration of ketamine, and we have a responsibility to provide an environment and a setting and teach clients about a mindset where they'll gain the most and benefit the most from their treatment here. And thank you for your time.
Hello, everyone. Does anyone want to take a moment and introduce the members of the team that couldn't be here today, or walk you through the various roles that we have at Field Trip Health? Tabitha, would you like to do it?
Yeah, I would love to. Thank you. So you see some of our psychotherapists up here. We have Nydia in the top left-hand corner, along with Ebony, which you had the great pleasure of listening to today. And then down on the bottom, there's Colin, who shared set and setting with us, and also Mo Brown, who's newly joining Field Trip here in Atlanta. We're so excited to welcome him and all the rest of them. We have two psychiatrists working with us. We have Dr. Galindo and also Dr. Price. They are the folks that you touch points with when you first join Field Trip and start your intake process. So they do your psychiatric consultation. And then we have Dr. Mensch, who also does some psychiatric consultation with us and is our medical director. On the bottom left, you'll see Natalie Castro. She is our medical office administrator. And she'll be talking with you a lot on the phone if you call in, or arranging appointments for you. And overall does a great job of organizing us here in the clinic. So we look forward to meeting you here in Atlanta. This is some feedback from some of our patients in Field Trip who have said, I feel better now than I have felt in a long time. I began to see the fog starting to lift and my throat unclench. I've heard more times than I can count that this is life-changing. And we often hear that, sort of, we model the relationships here and how to get along with each other well. So, we get a lot of compliments in that area too. So we get a lot of great feedback from our patients, and we're looking forward to hearing how your experiences with us have been as well. And if you want to get in touch with us, you can email us at atlanta@fieldtriphealth.com. Certainly you can find us on Instagram and Facebook at Field Trip Health. And we have a great website for you to check out too at www.fieldtriphealth.com.
Thank you guys so much for being here and sharing your amazing work that we have at Field Trip Health Atlanta. We are not done, folks. You guys have been asking some amazing questions in the audience section, and we would love to present them to our presenters right now. So let's hop to it. We have had a couple questions come through about the schedule of dosing. So let's say a patient could only come in once or twice per week, or doesn't exactly adhere to the same structure that we had outlined in the presentation just now. Evanye, can you speak to what that looks like in terms of how Field Trip deals with those situations?
Yeah, and it's a really good question because we've actually had that come up a couple times, right? And so people are busy, and we recognize that everybody has a really busy schedule. And so we do our best to work with you. Research is still pretty fresh out there. It's still brand new. We still don't yet know the full effectiveness. The model that was created is based on a lot of experience and a lot of research thus far. And so this is the model that we apply here at Field Trip Health. However, we know that you will get the experience that is meant for you once you go through the program. So yeah, we definitely will work with you.
Awesome. Thank you for that in-depth answer. That was great. The next question is, does our practice honor the rituals and traditions of indigenous cultures that introduce these plants into Western science? And if so, how? Dr. Mensch, I'd love to hear your perspective on this.
Yeah, this is it's a complex topic. And the answer, there's not simple answers. We all of us that have anything to do with psychedelic medicine and have anything to do with using non-ordinary states of consciousness to facilitate healing owe pretty much everything to the millennia of traditions all over the world that have cultivated and carried that knowledge and those skills through all the centuries and under incredible persecution. And that is something that I live with. I live with that recognition and think about all the time. Ketamine specifically, synthetic compound discovered in the 1960s. So for ketamine specifically, we're basically creating a tradition around it over the past several decades. That doesn't mean that there's no debt. That doesn't mean that there's no connection to the past, because like I said, it's the approach to healing that we're bringing in. And I think, the simplest answer, I think, to cut to the core, for me, my approach to these medicines and the mistake that I want to avoid repeating that's through a lot of conventional medicine is to focus on the molecules themselves and molecule delivery as if molecules heal us, and really to honor what's actually going on, which is moving things out of the way for our inner healing intelligence, which some people might call love, and other people might call spirituality. I love the phrase inner healing intelligence because it's really digestible and people really identify with that. But the use of ritual, the use of context, everything that Ebony was talking about with set and setting, all of these are part of a long tradition. And I think we all need to just be always searching for ways to bow to those who have come before us and and honor the gifts that we've been giving.
Thank you. That is really well said. Colin, do you have anything you would like to add to that? Dr. Mensch was very comprehensive, but I want to open the floor.
I yield to Dr. Mensch.
Awesome.
I guess I really like the focus on people bring the healing, the medicine being the catalyst, right? That's one of the things I love so much about what we do here. It's very client first. It's very person first. And it's so much against the traditional Western model where, we uphold the medicine as the thing. We're upholding our clients and their experiences and their lives and their innate healing, as Dr. Mensch was saying. So I think it's a great model.
Thank you, guys. Thank you for your perspectives. The next question is directed at Tabitha, who spoke about the importance of the setting. And with that in mind, what are your thoughts, Tabitha, for a virtual model of this approach? Would this be possible? And I think this question is very directed to the times that we're in right now. So I think if you guys could Tabitha, if you could shed a little bit of light on how we are also operating amidst the COVID-19 pandemic in order to do our very best to make sure that the illness stays at bay. That's probably part of this question.
Yeah, this is an excellent discussion to have right now. These are interesting times. I don't think any of us really know exactly what to predict for the future, but I will say that at Field Trip, we definitely honor the guidelines of the CDC. We are masked up and we ask that our patients do the same. We do as much as we can virtually, but in terms of having an exploratory session, that's what we really love about Field Trip, is being in our setting and having a psychotherapist there to be with you during your exploratory session. Really, we think is essential in a lot of ways. So, the virtual model for an exploratory is certainly not as ideal, I think, as the way that we do things at Field Trip. But we certainly do take a lot of precautions to make sure that you are safe when you're here.
Thank you. Ebony, do you have anything to add to that?
Yeah, absolutely. And, one of the things I wanted to add on to what Tabitha was saying is we do offer integration virtually. So if the client has to come in through the exploratory because they have to be dosed with ketamine, but for the therapy process, they can do that online. So that's one way that we also allow for clients to stay safe and to also save in gas too when they're coming here.
Very good point all around, for sure. Another question that's come through, and we'll take a couple more before we sign off for the evening, but another question that's come through is, how does the medicine affect your stomach? Is purging a thing? People are citing different sorts of psychedelics that sometimes have adverse effects, but I'd like to actually zoom this question out for a moment here and talk about any sort of adverse reactions that people might have, how Field Trip helps them through those adverse reactions, and what the things are, and then how situations and how sessions can still be effective and meaningful in the life-changing work that we do here with these adverse reactions in mind. So Colin, can you start us off, please? That's okay. Here, let me unmute you on my end.
Okay, this is a question about the medicine affecting the stomach.
Yes, and then larger adverse effects as a wider scope, and then how we at Field Trip take those opportunities to connect with our patients, deal with those adverse effects in the right holistic way, and then progress into the healing protocol from there. Well,
I love that we, in the intake, especially in the intake and in the preparatory, ask folks about if they have had adverse reactions to anesthetics and any stomach issues. So we can offer them Zofran ahead of time. And then Dr. Mensch, please back me up on this, and Tabitha, we see very little, very little stomach upset with this medicine. It's very rare. But again, we have the Zofran just in case.
Dr. Mensch, what do you think?
There, you see numbers in the literature like 5 to 10% experience some nausea. And of course, nausea is not the same as vomiting. Nausea might just be just a transient moment. And sometimes with psychedelic medicines in general, that kind of nausea can be part of the body process. It can be part of old trauma coming up. It can be part of the healing process. But for people that are either very sensitive and they get nauseated with small amounts of different medicines or with this medicine, and we know it's going to be a distracting issue or they vomit, then we have the option to pre-treat with ondansetron, aka Zofran, which is a very safe, common medication to suppress nausea and vomiting.
I have yet to have a client become physically ill or experience nausea, if that's any indication.
Thanks for your insight, guys. This next question I would like to pose to both Ebony and Tabitha, but Dr. Mensch and Colin, please chime in as you see fit. Due to the commitments that our program typically has, be it financial, be it time, be it scheduling, those kind of things, there is the perception that psychedelic-assisted treatments are quickly becoming cost-prohibitive and exclusive. So part of our mandate at Field Trip Health is to ensure that we have a diverse group of people that are both in our clinic staff and in our clinic patient base. And I'd love to hear from you guys about how we are currently working, and if you can speak about current and upcoming initiatives that are coming down the pipeline in order to make our treatments the most diverse and accessible as possible. I'd love, I think that that's what this question's asking. So Evanye, if you can start, we'd love to hear it.
I think one of the beautiful ways is, number one, acknowledging the diversity that Atlanta has to offer. I mean, our entire clinic is extremely diverse when it comes to some of these marginalized and in groups and of people. And there's lots of talk about how to help people afford this treatment. We've got payment plans, we've got discounts, we've got things that we can work with people on. And I know we recently just had conversations about how to include more people in these marginalized spaces. And I know, Tabitha, you were talking about this a little bit recently, if you would like to share.
Yes, I am so excited to share with you that Field Trip has really, I guess the best way to say this is, we're excited to take on some charitable organizations and do some pro bono work. So you'll be hearing more and more about that as we press forward. In Atlanta, we're looking at Positive Impact, which is an organization here that supports the LGBTQIA population and others that are HIV positive. And so we're really excited to work with that group. And we'll be doing that all across the United States as we scale up, looking at different organizations to work with. So thank you so much for that.
Thanks, guys. That's awesome. Why don't we take 2 more questions? Oh, Colin, please.
Oh, I was just going to say for everyone listening in, help us do this work. Talk to us, call us, come visit us. We're new to Atlanta. Our clinic is new to Atlanta. Some of us are newer to Atlanta. So we want to meet you. We want to know what you have to say. We don't assume that we're reaching out to everyone we should reach out to. So help us identify yourselves and let us know how we can become a part of healing, right? Because that's why we're here.
That is awesome. Dr. Mensch, do you have anything to add? I believe you are still on mute, so give me one moment.
I don't have anything specific to add unless anybody has any questions. Yeah.
Awesome. We have 2 more questions that I think we'll take from the audience. They're already submitted, so I'll roll through them very quickly now, and then we will sign off. One thing I did want to note too is that, again, if you guys have any other questions for our presenters outside of the ones that have been answered, outside of the presentation content, they would love to hear from you at atlanta@fieldtriphealth.com. As well, any care providers who are here, we would love to connect you to our care provider team at provider@fieldtriphealth.com. I'll drop that name in the chat in just one moment while our team is answering these next set of questions. But again, please don't be a stranger. I think Colin's sentiment about reaching out and getting in touch with us is the most important thing to do in order to make sure that our work is as connected to the North Star of healing in a holistic way as possible. So without further ado, I will pose one of the last questions, which is, are there any contraindications for using psychedelic assisted treatment in adults over the age of 65? And then maybe Tabitha, you can also speak to the contraindications of using the psychedelics over the age of 65, but maybe any other contraindications that we see in our clinics? How about I volley over to you, Dr. Mensch?
Yeah, well, 65 is kind of a boundary that's thrown around. It's a pretty arbitrary line. 65 can mean a lot of different things. So there's definitely no specific contraindication for being over 65. It's what's important is, are you cardiovascularly stable? For instance, someone in severe heart failure wouldn't be a good candidate. Someone with unstable angina, coronary artery disease, wouldn't be a good candidate. Someone with uncontrolled hypertension wouldn't be a good candidate. As I was saying earlier, ketamine is especially forgiving medically and psychologically. It's not impossible to. It's not without any risk, but it's especially friendly to complicated medication regimens, friendlier than a lot of the classical psychedelics, and especially MDMA, which is probably one of the more complicated ones when it comes to things like cardiovascular disease and other medications. And there are psychiatric contraindications. Most of them are relative. Absolute contraindication means just no ever. Relative contraindication, means maybe not, probably not. It depends. Right now, there's a really broad landscape out there of people that are working with ketamine for different indications, and including some indications that we are not approaching for engagement with this medicine right now. Mainly, and it's not because the last thing I would ever want is for someone who is told this is not the right place and time for them now, is to come away with a feeling like that they're too severe or beyond the help. It's that each clinic and each practitioner, including us, we know what we are equipped to support, and some things just require more support. So we help point people in the right direction if we decide it's not a good fit. But it's really, for most people, it's a conversation. If there's a question or it's a little bit gray, then it's a conversation and it's very individualized.
Thank you. That's a very detailed answer. Tabitha, do you have anything to add?
Mostly, I just like to say that ketamine is a very, very safe medication. I always open with that when I'm talking about ketamine. And not really much to add to that. That was a very detailed answer. Yeah, thank you.
Yeah, I would like to just point out, I think it's helpful to know this, that ketamine has been FDA approved for anesthetic indications since the 1970s. And a typical anesthetic dose, so a typical ketamine-assisted psychotherapy dose is anywhere from 25 milligrams to 150 milligrams. And a typical dose that you would get in an emergency room or hospital, even under very complicated circumstances, would be something like 350 milligrams, 500 milligrams. So we're talking about a very safe medication that's very safe in those circumstances, and using a dose that's just a fraction of what is considered very safe.
Thank you, guys. I think the last question we're going to take, I'm going to direct at Colin first, and it is, what training do you guys recommend or would you have to do, if any, in order to be able to facilitate this kind of treatment? And how can other people get involved in this slowly burgeoning renaissance of psychedelic medicine that we are in right now?
Yeah. Did you want to talk about?
Yeah, I'll answer first, and then we'll open it up in a moment.
Well, my first answer is, and the most important thing I think is to be a good practiced psychotherapist. Be comfortable working with folks from all different backgrounds, histories of trauma. I think any good therapist with those type of skills who puts clients first can be excellent at psychedelic assisted and ketamine assisted psychotherapy. So those skills are fundamental. In addition to that, what did we do, and what did Ebony and I do to get into this in particular? It was strongly suggested that we do an experiential training, as in experience the medicine ourselves. And so I'll speak for myself, I did, and it was a week of training presented by a gentleman he lives on the West Coast, who is phenomenal, has been doing this work for years and years. So it was a great opportunity to see how this is implemented and how it opens the mind up. So I guess it was kind of like a week-long boot camp, and we learned a whole lot. I guess I kind of want to hear what Ebony has to say as well.
Yeah, I really think that kind of training is what we did was profound. Having a background of really wanting to care for the client and being able to work with a group of client, you can't go wrong with that. On top of that, there's a lot of training programs out there that I think Dr. Mitch will definitely share. But you've got the CIIS program, you've got programs by Fluence. There's a lot of people who offer ketamine assisted or CAP experiential trainings and virtual trainings. So you can find psychedelic training in many places now to be able to provide this kind of treatment.
One more thing I wanted to add, or maybe the most notable thing from that experiential training for me was being with clients while they're journeying. It's the whole less is more approach, right? We're so used to in talk therapy, wanting to get more, talk more, be engaged, and sitting with, being with. And sometimes that means silence. Sometimes it means a lot of silence. Being there for, serving. It's a different way of being with people. It's really unique, and I really like it. It's different and very helpful.
Dr. Mensch, what do you recommend for training and getting involved in this field? Let's unmute you, and maybe we can start that answer again.
All right. Can you hear me now? Yeah. I think there's so many different ways to participate in the psychedelic renaissance, that, as a lot of people call it. And there's a whole lot of people that find themselves they don't have a medical degree, or they're not a therapist, but they're really passionate about what's going on. And what I've seen all over is people finding different ways to share their particular gifts. This work tends to spill over into all aspects of people's lives, and the healing process can be supported in so many different ways. I don't know if there's any gift that people have to give that can't support this work. So I would say that as far as being involved directly in psychedelic medicine, there's requirements set by law, licenses and education. And then, most of beyond that, though, there are the programs that were mentioned, including at CIS in San Francisco, and they now have opened another branch of that program in Boston. There's Prati, Psychedelic Research and Training Institute in Colorado. There's also the Integrative Psychiatry Institute that's doing a psychedelic medicine training. They're based in Boulder. Polaris Insight Center in San Francisco does some amazing online trainings for therapists and other practitioners, doctors, about using ketamine for ketamine-assisted psychotherapy. As Colin mentioned, mindfulness practice, meditation practice, that there can't say enough about that, just as far as cultivating presence. And then beneath all of that, humility. I think one of the things I love about the staff here so much is just the openness and curiosity and humility with which they approach all this work. I think that's the sine qua non, the most essential ingredient is just lifelong openness and learning. It's I think that when it comes to psychedelic medicine, it really can be the kind of thing where the more you think the more you might be boxing yourself into a closed trap. So just want to put that out there.
It's a great point. Thank you. And then last but certainly not least, Tabitha, do you have anything to add to this statement about training and getting involved in the field of psychedelic medicine before we sign off for the night?
Yeah, I just welcome everybody to get involved in the conversation if you have an interest in it. This is a new emerging, field of, for a career or just something just to look into further. So please get involved in the conversation. Come visit us for a tour. We'd love to meet new people. We've had people I've done many tours with people that are just like, I just love that what you're doing. I just want to come see you, talk to you, see how I can get involved, can I volunteer? We love those conversations. So please reach out to us. We're so excited to meet all of you.
What a lovely note to end on. Thank you so much to everyone in the audience who stuck around for the end of the Q&A session. We were so happy to be able to present what we do here at Field Trip Health. Thank you so much to Evanye, Colin, Tabitha, and Dr. Mensch for joining us tonight, giving your time to share the wisdom and the learnings that you guys have been living every day since we opened our doors at Field Trip Health Atlanta. If anyone in the audience would like to get in touch with us, we would love it. We absolutely welcome it. So please write to the email that is atlanta@fieldtriphealth.com or give us a call. Our phone number is 1-888-519-6016. It's all there. Write it down. Do not hesitate to get in touch with us, and we would love to hear from you. Thank you, everyone, for joining us. Have a lovely evening.